So, what do you think? Is all stress bad? While stress is not a mental health problem, it can bring on or make existing mental health disorders worse. So, it is important to recognize it and find ways to lower it. Well, here you can see how the stress versus performance changes, and too much stress is not good, and too little stress is also not productive. Some stress is good as it makes us perform well. Without any stress at all, there would be no drive to achieve anything. For most of us, it is time stress. Perhaps you all remember how productive you suddenly become the night before the submission of an assignment or presentation. So that would be the peak performance that we are capable of achieving. We'll be more focused, motivated, and in fact do very well. Whereas if it becomes too much, then the performance goes down, and also it affects both physical and mental health. So in your opinion, what is stress? Well, it can be a reaction that is to a situation that is threatening or challenging, where the outcome is not fully under your control. This can be a working definition of stress because what is stressful for one might not be so for other. Take, for example, driving. For some, driving is stressful, but some find it enjoyable. So basically, stress is when your resources are less than stress, then it is distress. And when your resources are more than stress or equal to stress, then it is eustress. It's a good stress. So, what are the resources that we are talking? So, someone feels stressed out when they actually cannot do something, or they believe that they cannot do something. So, either real or perceived inability to cope with the stressors can cause distress. A simple example for this would be someone who feels that they're not able to speak in public, even though they physically are capable of doing that. They have all the information they need, they're prepared, but they believe that they are not good at public speaking. That would be perceived inability. Whereas someone who is not prepared properly, who does not have all the facts and content ready, for them, it is actually real inability to cope with the stress of presenting something. So, either way, it can cause distress. So, what are the types of stresses and resources? There can be four types of stresses and resources because all these can be both stressors and resources: material, cognitive, emotional, social. So when we are talking about material, it could be time, money, or house, things like that. You know, so you can either have money or not. So if you have money, that is a resource. If you don't have money, then it is a stressor. you know. So similarly, social support also. So if you have social support, it's a great resource to tide over a lot of problems. But at the same time, if you are isolated, if you feel abandoned, then it is a stressor. Okay. Similarly, the cognitive and emotional also. By learning some cognitive and emotional skills, one can manage stress better. Okay. How to manage stress with cognitive skills? Cognitive is thinking, the ability to understand, apply, think logically, all these things are like cognitive skills. So let us say there is a stressor. There are four ways that you can deal with that. We call that the four A's of stress management. The very first one is avoid. Avoid any stressor. It's very easy to say that, right? Okay. Sometimes you may not be able to avoid. Then there is another way of doing it. Alter your circumstances. If not, adjust yourself to suit the circumstances. The final and fourth one is accept. When all else fails, accept. We'll go into them a little bit more. Trying to avoid a stressor might not always work, as you can see in this Peanuts comic. Yes, it would be good if you can avoid the test, that then there won't be any stress. But tests are part of parcel of life of a student, so it's not possible to avoid it. So what can you avoid? Obviously, you cannot avoid everything that causes you stress. Some of them are inevitable, but there are some that you can avoid or at least minimize, stressors. So, for example, some people want to clean their house even though they don't have the time or energy to do so daily. And as a result, get stressed out that they cannot spend time with their partner. That they can lower the expectations that the house has to be clean, spick and span clean all the time. Okay, that's an avoid technique. Maybe perhaps they can clean once in 2 days, if not once every day. And if it is stress is caused by people that you interact on a daily basis, then you can minimize the interaction so as to avoid stress. Obviously, you cannot completely avoid these people, but you can try to minimize the interaction. Avoid social media if it is causing stress. A lot of people feel stressed out when they compare themselves with how well the others are doing and what is lacking in their lives. If that is a cause that is causing stress, then avoid social media so as to lower the stress. And as mentioned earlier, avoid activities that are not a priority, as in like spending time with the partner is priority. Then avoid the activity of cleaning the house on that day when they are free. So these are some avoid ideas, and you can think of others also. When we talk to our callers, we can try to find out what are the areas that they can avoid. you know. And the next comes, okay, it's alter. When you cannot avoid something, try to alter the environment to lower the stress. Some alter ideas are to communicate openly, to resolve conflict. So, when we are talking about avoiding, you cannot avoid being in contact with your family members with whom you live on a daily basis, and with your team at work whom you have to see on a daily basis. In such case, you can try to communicate so that you can come up with a win-win situation. For that, you can learn assertive communication. What is assertive communication? Assertive communication is a type of communication where you let the other person know how you're feeling and what you would like to have, while respecting that they also might have their rights and their choices and preferences. So it's trying to resolve the conflict in a more mature adult way rather than fighting with someone, which would be aggressive communication, or quietly taking it until you cannot take it anymore, which would be passive behavior. So just taking the orders from others even though you don't agree with them, that would be passive communication style. And aggressive is like you're not able to take into consideration how the other person is feeling and just lashing out or shouting, things like that. And there is another type of communication also, passive aggressive, which is like making jokes not exactly in good humor, but making comments behind the back of someone, or gossiping about someone you don't like, that is called passive aggressive behavior. So what we are trying to achieve is assertive communication. And there is like kind of a format, which is broadly speaking, letting someone know, like, when you did something, I felt this way. Next time, can you please do this? You know, so an example of this would be, let us say your boss has a habit of shouting in front of everyone, and every time they do it, you find it uh, like demeaning, and you don't like it because your colleagues will be looking at you. So what you can do in person is go to your boss and let him know or her know that when you shout at me in front of everyone, I feel uh, like I don't feel good. So next time, if there is any problem with my work, can you please let me know in person? I'd appreciate that. I'm willing to change, but can you please let me know in person? So that would be an assertive communication, whereby you are letting them know clearly what you want. At the same time, you are not shouting, or you are not quietly taking it. And you can actually have an activity to practice assertiveness. And sometimes saying no is very important. Some people do not know how to say no, and whatever work is given to them, even though they are not able to do it, even though they know it's going to take a long time and they have to put in long hours into it, they will still do it because they are more passive. So instead, learning to say no when they cannot do it and politely letting the other person know is again an assertiveness skill that can be very helpful. And asking for help is also a very good way of alter idea, because a lot of people are willing to help if you ask for it. People would not come straight away to help, noticing that you are having difficulty, but when asked, most of the people are willing to help. And this has been noticed again and time and again in some of the experiments done in psychology, where someone who is in trouble, who fell down or who was distressed, if they don't say anything, people just pass by them. And the moment they start asking for help, then there will be a lot of good Samaritans willing to help. Hmm. And last but not least is time management. It is an alter idea to change your circumstances, because if you have to do these many assignments in this much time, it can cause stress. But by planning right from the beginning, allotting enough time, and also time for any contingencies if plans don't go well, and with proper planning, then the stress can be lowered. The work is still going to be the same, but at least the stress can be lowered. So time management is another alter idea. And next comes adjust ideas. So what are the ways that we can adjust ourselves? Perhaps you can adjust your standards, internal goals versus external goals. Most of the time, when you work for an external goal, you do not have 100% control over the outcome. Whereas if it is an internal goal, then you have most of the control, and that lowers stress. Remember, anything out that causes stress is something where you do not have control over the outcome. Yeah, so when it is an internal goal, then you will have control over it. Let me give you an example for this. For example, like if a student is aiming to be uh, achieving first in their class, first rank in their class, then it is an external goal. They're trying to uh, achieve something that has influence from other people also. Whereas if it's an internal goal, which is learning the subject as best as they can and doing better than they did last exam, is an internal goal, which is entirely in their control. So that's the way we can change the standards. Reframe. Reframing is about looking at a situation, thought, or feeling from another angle. For example, if there is some difficulty that you're facing, just thinking about it is going to make you feel all stressed out. Then, for a minute, you can ask yourself, if your friend were to be going through the same problem, what would you say to them? You know, most of the time, changing the perspective that way makes it easier. Because when we give advice to someone, we say, it's okay, you will do well. No, you don't have to worry. But when it comes to ourselves, we are not in a position to say that. So sometimes just stepping back and looking at the problem from outside and maybe through somebody else's eyes would be helpful. And this is another technique that can be used when something is causing distress. This is like looking at any problem and seeing how important is that issue in 10 minutes time, 10 days time, 10 months time, and 10 years time. Again, applying it to relationship or an exam, the question to be asked is, yes, it is very distressing at the moment, but how important is it in the long term? If it is important in the long term, then it is something to be worked at and found a solution for. But let us say in 10 years' time, if this issue is going to be very insignificant, then you don't need to spend too much time on it, worrying about it. It could be an exam result. Let us say in the classroom there was a pop quiz and you failed miserably. Yes, you feel humiliated for 10 minutes, perhaps maximum 10 days, but in 10 months' time, would you be affected in the same way? And how about 10 years' time? So it's a way of getting over some emotional distress. And the next one would be practicing gratitude, looking at things that are going right rather than those that are going wrong. So when people were asked to write about three things that they're grateful for a month's time, they have noticed that the depression levels have drastically changed, majority of them. So being thankful for what we already have is a very good strategy to maintain stress levels at a lower levels. And learning new skills is an just idea, because here you are not able to avoid whatever that is causing you stress. For example, you feel inadequate at work and you cannot alter the environment, you cannot quit the job, you cannot change jobs, you cannot move the department. Then what do? You change yourself, you adjust to the environment by learning new skills, putting in time and effort into learning new skills so that the stress can be lowered. Next is relaxation techniques. This is also one way of managing stress. Things like deep breathing, exercise, yoga, meditation, tai chi, all of these help in feeling relaxed and managing stress better. Next comes accept. When all else fails, then the best way to manage this is stress is to accept the reality. The first step for that would be identifying the amount of control you have over the situation. For this, you need to see where you stand. What are the things that you have control over? Do you have control over the traffic on the road on any given day? So, what is the point of getting stressed out about the number of cars on the road? A lot of us do this, right? Why is there so much traffic? You know, because you're getting late to work. And that's the story every single day. So, rather than getting so stressed out about things that you do not have control over, it's better to see what you have control over and change or adjust accordingly. For example, you can leave early so that you'll be on time, or you can plan your trip in such a way that you can travel in off peak periods, or you try if you can see, like, at work, you can change your working hours. Maybe you start early and leave early, or start late and leave late. You know, just for the all of these things, the first step is to see how much control you have over the situation. And you can also, they can call befrienders or talk to someone you trust. That's one way of lowering the amount of stress. And hopefully, by the end of the talk, might be able to accept the situation as it is. And learning from mistakes is another accept idea, because sometimes we make mistakes and we beat ourselves for that and keep on saying, like, why did I do it, why I have done what I have done, if only I didn't do it. That is not going to help in any way. Just accepting that mistakes were made, and what can I learn from that mistake so that I do not repeat the same mistake. So that lowers the amount of guilt and stress. And forgiving yourself and others, again, is the same thing. What you have done, have already done. What others have done, they've already done it. Now things will not go back to being what they were before. So just accepting that reality and forgiving, not forgetting, forgiving yourself and others, and learning from the past experiences is going to be helpful. Because accepting the reality, in that, mindfulness meditation can be very helpful. Just noticing the thoughts that are coming up and realizing here and now is what matters, not the past, not the future. Present is what matters. What can you do now to make things better is all that matters. Because Buddha says the first arrow hurts. Why do we shoot the second arrow into us, ourselves? What he means by that is, in life, we cannot always have control over the first arrow, problems, whatever they are. But however, the second arrow is our reaction to the first. The second arrow is optional, you know. So why do you want to keep worrying about something over and over again and trouble yourself even more? What you don't have control over, you don't have control over anyway. But whatever is in your control is your reaction to the circumstances. So once you have that control, at least you can lower the pain and suffering and the stress that brings upon. You know, and when you're forgiving and yourself and others, something to remember is, when you have done what you have done, or when they have done what they have done, you or they were working at the knowledge you had at that time. On hindsight, probably we would have done things differently, but it's over. So there is nothing much that can be done now. So moving on and accepting the reality and moving on is going to be helpful to manage stress. So that is about stress. The next comes anxiety. Anxiety is also very, very common. A lot of people have anxiety, and even it is natural to feel anxious from time to time. We all must have experienced it. It's not something that can be called as a disorder or anything. That's a natural reaction to excessive amounts of stress. But if it has become chronic, if it continues to be too long and affecting daily life, then it is a cause of concern and can be classified as anxiety disorder. So, what could be the causes for anxiety? As you mentioned, long-term stress, uncertainty about future, which we all have experienced during the COVID-19, and whenever someone loses their job or like waiting for the exam results, things like that. And physical health also is an example, like of anxiety situations. Again, COVID-19 situation, a lot of people had health anxiety. And then sleep, if there is not enough sleep, then people can feel anxious. Relationships can cause a lot of anxiety, and we do get a lot of callers worried about their relationships, upset about them, and that is another major reason for our callers distress. And perfectionism, some people want everything to be perfect, and that can cause anxiety because generally nothing is perfect. And financial problems also can cause stress and thus anxiety, because you don't know what tomorrow is going to bring and how you are going to survive without a job, things like that. And diet, too much caffeine can cause anxiety like symptoms. And social media use can cause anxiety. And also medication, certain medication can cause anxiety, like steroid medication, asthma medication, medicines used for seizures, ADHD, attention deficit hyperactivity disorder, and Parkinson's, thyroid. All these can be causes for anxiety. Even though stress and anxiety look similar, there are some key differences between them, as you can see in this table. Where stress is external, anxiety is internal. By this, I mean if some like material things that cause you stress, anxiety is more of how you think and feel about something. And generally, stress is short term, but anxiety is long term. And stress, you know the trigger, what is causing it, whether it is an exam, whether it is a relationship, it is very clear. But in anxiety, it may not always be clear of the person suffering. They have this vague feeling of anxiety, don't know exactly why it is so. Especially this is true for people who have like generalized anxiety disorder. And the basic emotion is like overwhelm in stress. It feels like too much. I cannot handle this. It's like, too much for me. But whereas with anxiety, it's mainly worry and fear that something bad is going to happen. And when it comes to the distress these things cause, stress is generally mild, but anxiety is like severe. Also, the outcome, someone who has been exposed to stress for too long, burnout is what comes out of stress. Like someone who is overworked feels like burnt out, whereas with anxiety, panic attacks can happen or other anxiety disorders. Even though we use the word anxiety loosely, to be diagnosed with it, it should be one of these five. And medication and cognitive behavior therapy can help manage anxiety. We'll go more in detail about each of these anxiety disorders a little bit in the coming slides. First is generalized anxiety disorder. It's like I said, we all have anxiety from time to time. Someone with generalized anxiety disorder or GAD is like excessively worried about a lot of things: secure job security, performance, health and safety. They worry what happens to their loved ones, that they might get involved in an accident, or like their safety is threatened, and they're worried about finances. Even though they have a reasonably good amount of money, they still keep worrying about it. And some people are like excessively worried about being late, so they try to avoid that. And I know someone who mentioned that in the fear of losing missing a flight, they used to go to the airport and sit like 5 hours, 6 hours before time. That is the kind of anxiety that we are talking about. And completing household chores and responsibilities. So once they know they have to do something, they simply find it difficult, like impossible, next to impossible to relax. The thought is like always on their mind, like, I need to complete that, I need to complete that. You know, so that is the kind of thing. And it affects the way they behave also, like talking, like taking excessive precautions or totally avoiding some situations. So that is the kind of anxiety that we are talking about. Children also can have GAD, and they generally worry about their performance at school or sports, and they are always afraid of like calamities, earthquakes or war, things like going to happen, all these things. And also worried about the health of their family members, especially parents. So children can have these worries that they always don't talk about, but they suffer a lot from these things. The next is like panic attacks. It is an extreme discomfort or fear that suddenly comes on and lasts for few minutes. After a few minutes, the body returns to normal. So it's not dangerous, but for the person, it feels like they're dying. A person who experiences a panic attack may avoid the place or activity, thus limiting their quality of life. For example, refusing to take the lift. If someone is going through a panic attack, it helps to breathe. There is a breathing technique that can use to help, which we will learn in the next slide. So all these are the symptoms that a person with a panic attack might be experiencing, and some of our callers do talk about this. They said, I had a panic attack. I'm having a panic attack right now. So if they say that they are actually in the middle of a panic attack, then you can help them by teaching this way of breathing. It's like 4-7-8 breathing helps to bring the balance back between oxygen and carbon dioxide in the body, thus bringing the panic attack to an end slowly in time. So what they need to do is, like, you can teach them to do it with you if they're having a panic attack right there, or you can ask them whether they know how to breathe if they're having a panic attack. If they don't know, then you can ask them, would you like me to teach a method? I heard about something that's they say works for panic attacks, then you can teach them. Like, you breathe in for 4 slowly through your nose and hold it for 7 count. This is just counts, yeah, no need to be seconds. Just 1, 2, 3, 4, breathe in, and then 1, 2, 3, 4, 5, 6, 7, hold, and then 1, 2, 3, 4, 5, 6, 7, 8, breathe out through the mouth. Then it makes it easier for them to manage their panic attack in time as they keep practicing this type of breathing. Okay. So what are the common causes of anxiety? Well, sorry, I mean panic attacks. It's caused by anxiety. Generally, people who have panic attack tend to fear, like, loss of control. When they are no longer in control of something, that brings on that panic attack. And phobias sometimes can cause panic attack, um, as in like someone who is afraid of flying can have panic attack in the flight or in a lift. Hormonal changes also can bring on panic attack. When the thyroid levels are not right, then too high, then it can cause a panic attack. And too much caffeine can cause panic attack in people who are sensitive to caffeine. And prolonged stress also can lead to panic attack. Or sometimes major negative event of someone passing away or being involved in a major trauma or accident can bring on a panic attack later. How do we support someone who has panic attack or panic disorder? If they constantly keep thinking about getting another panic attack and worried about it, then we say that it is a panic disorder. Okay, so what do? We listen to their fears without dismissing. Keep your voice calm so that they also can relax, because generally people with anxiety speak too rapidly. If you also speak at their pace, it's not going to be helpful. So you just slow down your voice, you lower the volume and talk gently so that they can pick up on these uh, sounds from you, that and then calm down themselves slowly. Helps to You can help them to relax with breathing if necessary. And what you should not do is say that it's okay. No, it's okay. It's nothing. No, it's not a major thing. Don't say that it's okay. It's not okay. At the same time, don't overreact to that. Oh my gosh, it's like what is happening to you? When they say that it feels like I'm dying, I'm not able to breathe, then you don't go along with them and say, oh my gosh, call the ambulance, no, this minute. Then no need to overreact. If you keep your voice calm and talk to them slowly and then let them breathe in deeply, that can help. Like as we mentioned earlier, no need to do anything else. It's just temporary and it will pass.
These 3 letters get thrown around way too casually.
Does your raccoon have OCD? Maybe?
Welcome to Watch Mojo's Top 5 Myths. In today's installment, we're counting down the top 5 myths about OCD, also known as obsessive compulsive disorder. Before we begin, we publish new videos every day, so be sure to subscribe for more great content. In our modern society, the term OCD is used quite liberally, often as a joke or to insinuate that someone is fixating too much on a given task. But in reality, OCD is a serious anxiety disorder that can have a significantly negative impact on one's ability to lead a productive, well-balanced life. Come along as we break down the common misconceptions and generalizations pertaining to this condition.
They're hard to diagnose, so people don't always appreciate that they're serious problems.
Myth number 5. OCD is all about cleanliness and organization. We've all seen depictions of OCD in popular media. It usually involves meticulous cleanliness or people repeatedly washing their hands. While the compulsion to keep things extremely clean and well organized, or a fixation with personal hygiene are certainly common among those who suffer from the disorder, such tendencies are far from universal. For some, anxiety manifests in alternative obsessive compulsions, such as irrational chronic fears ranging from accidents to certain numbers or colours, or the need to repeat certain actions ritualistically, like locking doors. A key example that undermines the neat freak stereotype is hoarding, which is in fact a very common symptom of OCD. Myth number 4, OCD is an adult problem.
When I was a kid, I counted telephone poles from the car. If I missed one, we'd crash.
Kids can be a mystery. Just ask any parent. A child's development takes countless twists and turns, and newly developing behaviours can be hard to keep up with. It's often tricky to distinguish a tidy, hygienic, or safety-conscious kid from one exhibiting symptoms of OCD. The anxieties and rituals, if present, are similar to those of their adult counterparts, just transposed onto a child's life. It's estimated that 1 in every 200 kids has OCD, although other studies have suggested that it's more like 1 in every 100. Obsessive compulsive disorder can be particularly hard on kids, as most have little knowledge of OCD and likely lack the vocabulary to clearly express the abstract anxieties they're experiencing. Myth number 3, it's untreatable. OCD can be a source of shame or embarrassment for those who suffer from it.
Why are you doing that?
More important question is, why are you?
It's just a habit.
While any mental illness can prove challenging to overcome, those who suspect they're experiencing symptoms of OCD should seek treatment, because it exists and it often works. There's no magic pill to make the feelings go away. General anxiety medication may be prescribed to take the edge off, but perhaps the most effective treatment is exposure and response prevention, or ERP. This type of cognitive behavior therapy exposes the patient to anxiety triggers in the form of ideas, images, videos, or items. With help from the therapist, the patient learns to appropriately process their anxiety rather than resorting to ritual soothing. Myth number 2, people with OCD are unaware of their actions.
You really think that I'm
Obsessed?
When you're constantly getting stuck in rituals or experiencing intrusive anxious thoughts, your issues become self-apparent. Most OCD sufferers are well aware of the condition, they simply don't wish to discuss it. There are, however, people who are unaware of their own obsessive need for order and control, but they likely have obsessive compulsive personality disorder, or OCPD, and not OCD. It's similar, but ultimately a different beast. With OCPD, everything stems from a need to control your environment. Because these compulsions relate to upholding unreasonable personal standards, rather than soothing intrusive thoughts via ritual, individuals with OCPD often view their compulsions as, quite simply, the right way to do things and see them as entirely normal.
I have things a certain way.
Myth number 1, it's all about repeating the same actions.
I'm obsessive compulsive. Yeehaw! 1, 2, 3, 4. Yeehaw! 1, 2, 3, 4.
We've already touched on this briefly, but it's worth going into further detail, because when it comes to OCD, this is arguably the most pervasive myth. When someone performs the same action multiple times, or finds himself unable to stop performing a certain task, it is referred to as getting stuck. While this is a common issue for individuals with OCD, the assumption that it's the default behavioural pattern is a serious disservice to this nuanced disorder. Some patients exhibit no external symptoms whatsoever, experiencing what is known as purely obsessional OCD. In such cases, all anxieties and subsequent soothing rituals are performed mentally. While it may sound preferable, many sufferers describe it as a constant, exhausting mental battle.
Do you agree with our picks? Check out these other great clips from Watch Mojo and subscribe for new videos every day.
When we look at OCD, it is like a cyclic thing. What happens with OCD is that people tend to get obsessive, intrusive thoughts, the thoughts that just don't stop. For example, if you have ever experienced a song stuck in your mind, like constantly playing. So similarly, they have disturbing intrusive thoughts, which cause quite a lot of anxiety. And to relieve the anxiety, they start using certain rituals like locking 3 times or washing hands 7 times or reciting something in their mind 5 times, like something similar to that, these things. So once they do that, it gives them some temporary relief. And again, the intrusive thoughts, as and when they come in, the anxiety builds up. Again, they follow the ritual, which gives temporary relief. So it's like a cyclic thing that keeps going on and on and on until it becomes unbearable for the sufferers and they need to seek treatment. Because we classify OCD as something that takes up more than 1 hour per day in these rituals. Then it's diagnosed already as OCD. And there is medication for that, as you have watched in the earlier video. So next comes PTSD, post-traumatic stress disorder. It is natural to feel anxious after a trauma, but if it persists for long periods of time, then it could be PTSD. After a traumatic experience, about 20% of the population might be affected by PTSD. So after a trauma happens, not everyone is going to get PTSD, but 1/5 of the population approximately might be more prone to getting PTSD. So trauma, as in it could be a personal disaster or a natural disaster. So sometimes if there is a major flooding or fire accidents or war, things like that, then people tend to be hyper vigilant all the time, and then they keep dreaming about the traumatic event. and they're always like, on guard and jumpy, unable to sleep, and have issues like alcohol abuse, all these things, as you can see here. So these are all the effects of post-traumatic stress disorder. And we can look at the causes and symptoms. Past trauma, as we have mentioned earlier, accident, abuse, both physical or sexual abuse, war, natural calamities, and the symptoms are hypervigilance and nightmares, anxiety, flashbacks, as in like they feel that the incident is happening right now, so it's like they're reliving it over and over again. It's almost like they're in a loop and not able to come out of it. So how do we support them? As with everything else, listen and explore the effects. As in, like, how is it affecting their daily life? What is happening when they feel this way? And validate, like telling them that it is natural to feel, uh, these symptoms, as in like being hypervigilant or getting nightmares, because it must have been quite traumatic for you. That is why you are still affected by it and are suffering or finding it difficult to relax. So that validates what they are feeling. Then provide information appropriately. If they ask for it, then you can provide information about this. Like, you can tell them that it is possible for some people to experience the symptoms like, like PTSD after a traumatic event. So have you had it checked? Have you seen any professional for what you are experiencing? Or do you want to consider? You can ask them, but do not press for details of the traumatic experience, because that can re-traumatize them. So you do not need the details of it. It has to be done in a safe space with a professional who is trained to deal with that. So if they are not willing to, or if they are not volunteering themselves, do not ask for any details of the traumatic experience. Okay. A number of young adults experience social anxiety, and it can affect not just their social life, but work life too. Generally speaking, females tend to be more affected by anxiety disorders, all anxiety disorders, but with social anxiety disorder, the number is same almost for both male and female. And people who experience social anxiety tend to have all these symptoms when they need to meet someone, like, in groups or single. So they actually have difficulty socializing, and the thought of meeting someone makes them dread, and they can experience all physical and psychological symptoms whenever they think of meeting someone. I mean, like, not having some amount of anxiety is normal, but if it is really interfering with their social lives and causing all these symptoms every time that they need to meet someone, then it is already serious enough to seek help. Next comes depression. It's one of the main causes of suicides and is most prevalent mental health problems along with anxiety. Anxiety and depression together can cause almost 1/4 of the mental health issues. They comprise 1/4 of the mental health issues that people experience. So it is important for us to be aware of depression, what it means, and what sufferers experience, and how we can support them. So as you can see, the numbers are very high, and suicide is like actually the fourth leading cause of death in young people. And in Malaysia, between 8 to 12% of the population might be suffering from depression. Even though we use the word depression commonly, generally the understanding is that people with depression tend to be sad and all the time in low moods, but it may not necessarily be true because there are different types of depression. The major depression is what we commonly refer to as depression, but there is another thing called as persistent depressive disorder, where it is a milder form of, in a way to say, of major depression, where the low moods can go on for years, and it may become severe in future, but people can still manage, even though they feel low most of the time, and they feel helpless, stressed out, anxious, all these things along with depression. And even children also might have persistent depressive disorder, PDD. And a person with PDD tends to have like a gloomy personality, as they're not able to enjoy life. So it is always like someone who has a negative view of the world also. And bipolar, on the other hand, is ups and downs of mood. So they might have like periods of like major depression, and they can also have periods of like high energy states. We will discuss about it later. And postpartum depression is what some women experience after delivering their child. And seasonal affective disorder is where the winters, when there is no sunshine or not enough of it, then that can affect the mood of people and they might experience symptoms of depression. So these are all different types of depression. We all feel low sometimes when things are not going our way. But in clinical depression, the low moods last for days. Contrary to common belief, depression is not just sadness. Some people have anxiety and irritability too. Especially in males and teenagers, anger is more common. Whenever someone is depressed, it is a good idea to ask whether they or their family members or friends have noticed any of these signs that you see below. One of the major indicators would be like social isolation, feeling hopeless, helpless, or in extreme cases, thoughts of suicide. And immediately noticeable behavioral changes would be either sleeping excessively or not sleeping at all, either eating a lot or not eating enough. So weight also changes. So these are like physical symptoms, and they can feel all some of them feel like exhausted. Even though they're sleeping a lot, they still feel exhausted. So, and some people find it difficult to concentrate at work, focus on their work, study. So that can affect their grades if they're students, or the quality of work they produce if they are working adults. So these are the common signs, and be aware of these whenever you are talking to the callers. If they complain of like feeling tired all the time, even though they're sleeping much, and they are no longer enjoying what they used to enjoy before, they don't want to meet people much, or they're finding it really difficult to concentrate and work, or like sleeping a lot. Whenever you hear any of these complaints, ask about all the other signs and symptoms, and so that you can let them know that there is a possibility that they might be having like depression or any check with their doctors, so that they can take care of themselves and feel better. There are a number of ways to treat depression. Generally, if it is mild, then medication may not be necessary for some people, but depending on the severity, the treatment differs. Severe depression requires medication, and it takes about 2 weeks for it to be effective. Sometimes the side effects can make the sufferers to stop taking the medication, and they need reassurance and encouragement to continue. Okay, so apart from medication, other things that can help could be As you can see, exercise can help, good quality diet can help, and having good social connections can help, family support can help, and music therapy also people use that, art therapy is used, and sticking to some schedule and sleeping properly also is useful, and using some like yoga, meditation, all these kind of things also can be helpful. So you can look at all these possible ways, and when someone is talking about their depression, then you can check how many of these they are following, just asking like casual questions. So what time do you sleep, how much sleep are you able to get, and how is your diet normally, and is it possible for you to go for a walks, or do exercise in some small way, so things like that. And when we are talking about depression, earlier we said like bipolar disorder, right? It is more like lows and highs. So when they are like going through the depressive phase, it looks very much like regular depression, regular as in like major depressive disorder, where they feel that low moods and suicidal thoughts and sleeping a lot, all these things. But the other side of it is the manic phase. In this phase, they are like they have like too many ideas running around in their mind, and they talk a lot, and they take rash decisions which are not exactly prudent, so they lose money also sometimes, or uh, it affects their finances, and it might affect their business work, all these things. So it has like yo-yo kind of moods sometimes. So the frequency can change. For some people, depression lasts for a few months and then comes a manic phase. For some people, it quickly keeps changing. It depends. And because of this like up and downs in the mood, it can be difficult to get family support for bipolar because of the manic phase, especially in bipolar 1, the mania is like very clearly noticeable, and in bipolar 2, which is like in which there is a hypomania, they don't do like this like vastly different things, but they're constantly on slightly on high alert. So sometimes it can be difficult for those around the people with bipolar, mm, because they don't know exactly how to behave with these people. It can be a bit confusing for them, not knowing when they will be in a good mood and when they will be in a low mood. So it can be difficult for family members as well as for the person going through this. In the manic phase, they feel very confident, and they can conquer the world kind of feeling. But when it comes to the depressive moods, it's terrible, like highs and lows of the moods. So for these medications need to be taken for life, and they are used as like to stabilize the mood. Without it, as you can see, it can go very high and it can come very low. With the medication, it stays in the band that normally is acceptable. Here we can see the difference between anxiety and depression. For example, if there is a tiger, then if it's anxious monkey, then there is this possibility of a tiger being there, and it might not be safe. I better hide myself. Be safe, to be safe. So the feeling here is like the uncertain event, undesired event is in future. So you feel like kind of helpless, like you want to keep yourself safe. So the behavior would be avoidance, like trying to keep yourself away from whatever the stressor that is around there, the danger, perceived danger more like. Whereas when it comes to depression, it's like almost like given up. It's not that there might be a tiger They are always there. They're everywhere. So nowhere is safe. Even if I try to hide, it's not going to help. So I as well just give up. I don't want to try anymore. So it's like the major event is certainly there for it, and sense of control is none, and behavior is complete withdrawal, like already exhausted. I have tried fighting, I have given up. That kind of feeling is depression. Like I cannot help myself anymore. So it's helplessness that you see specifically in depression. Helplessness and hopelessness, when present, is a very good indicator. Both of them are very good indicators for depression. And when there is a tiger and it's not easy to avoid, it can cause stress and feelings of overwhelm. So unattended stress can lead to depression also. Now that we have some understanding of stress, anxiety, and depression, which account for the majority of mental health issues, let us see how we can manage mental well being. Then, when we attend to our callers, we can ask questions to find out how they are managing their stress and explore whether they can utilize any of these strategies. There are different ways to manage mental well being. All of these put together can help in managing mental well being before things escalate and lead to illness. So, to start with, are like simple lifestyle changes, are like diet, sleep, exercise, because diet makes a huge difference in a number of ways. In anxiety, for example, if you are having too much caffeine and you are feeling anxious, the first thing that you might want to try is stop taking coffee. Or, for example, some people, it's noticed that having low in iron content in your blood, like anemia, can mimic symptoms of anxiety. For some, if they have not eaten well, like low blood sugar, can cause symptoms of can mimic symptoms of anxiety. So first and foremost, it's important to take care of your diet and see if things improve or not. Similarly, sleep. For sleep, sleep deprived people tend to get more the mental health issues because the brain needs that relaxation and that rejuvenation, and if that is not achieved and if you are not getting enough sleep, then the signs and symptoms of whatever mental health issue there is tend to get escalated. A very good example of this is bipolar. People who do not have enough sleep tend to have more of the manic phase. And similarly, exercise. Exercise seems to help with mild depression. So some of the psychiatrists are actually suggesting that people use exercise to help themselves if it is mild depression, or in addition to the medication that they are using, because it's not just for the body, the exercise is good for the brain also. So all these lifestyle changes affect in one way or other our mental well-being. So if you are having healthy diet, and if you are sleeping well, and if you are exercising on a regular basis, generally speaking, you can maintain your mental well-being in a good shape. Yes. And next comes attention centering strategies like breathing, like focusing on the breath for a few minutes every day can help you relax and feel better for the rest of the day. Or the breathing can be utilized as and when needed throughout the day. And similarly, meditation, few minutes of it, sparing a little bit of time for that, can do wonders to your mental well-being. And visualization, for example, if somebody is like having a social anxiety, then visualizing them seeing themselves like confidently talking to someone, that is going to help also. So it's good to have these as a regular practice so that you have these skills when you really need them. When you feel anxious for a minute, for a few minutes about some major event, then you can quickly utilize these skills that you already have been practicing. Okay. And the next way would be creative or distracting strategies. And especially this distracting strategies help quite a bit with anxiety. And you can use your hobbies so that you can focus on that, and the negative thoughts that keep bothering you. For example, if someone has obsessive thoughts like constantly bothering them, then they can immerse themselves in some hobby and distract themselves for some time. And physical movement, as in dance or exercise, all these also can help to distract someone. They can use any other sports, whatever it is, that they can do that. And recreation, again, any of these ways, they go out, watch a movie, go window shopping, any of these things. And all these are either you use your creative part of the brain, or distract yourself from whatever it is that is constantly troubling you. And another way would be cognitive strategies. These are actually to do with the way you think. And by changing the thoughts, it's possible to change the feelings and behaviors. So there are links to various resources for self-help and information available in the notes given to you. So you can refer to them and utilize them, and you can assist our callers also to share this knowledge if they're willing to ask for it, if they're willing to take it. So journaling is a very good idea to feel uh, calm, because some people are very anxious, with a vague feeling of anxiety, not exactly knowing what is causing that anxiety. So by journaling out, writing down what it is, what happened before they started feeling anxious, and what is happening right now, what is the worry that they are having, all these thoughts when put on a piece of paper can help them calm down. And it has been already proven with experiments also. And then self-monitoring, again, noticing when they are getting the negative thoughts and how it is affecting them, and things like that also can be helpful. So mindful meditation can be useful here. And communicating, talking about this, letting people know, and sharing, even though it may not always resolve the problem, can help someone feel better. So all these ways that to manage the mental health, you can use on your own, and you can also help the callers to explore these options, and you can check whether they are following any of these, and whether they would be interested in trying any of these strategies also. Okay, so that way, hopefully, they'll be able to manage themselves better. Okay, thank you.